Hey friends, let's talk about Molichs test, which is famous for the detection of carbohydrates in a given solution. So first of all, let's talk about its principle. So Molichs test takes advantage of the dehydration properties of carbohydrates. So if carbohydrates are treated with a non-oxidizing reagent like concentrated H2SO4, they undergo dehydration and form a compound known as hydroxymethyl furfural. So this compound is highly volatile and it's colorless. So we treat it with a indicator so it produces a colored substance, and it is an indication that carbohydrates are present in the given solution. So we have talked about principles, so let's talk about the reagents which are used in this test. So the reagents that are used in this test include concentrated H2SO4 given carbohydrate solution, and an indicator which is 5% alcohol naphthol. So it acts as the indicator. So now let's talk about the procedure of this test. So first of all, we will take two test tubes. We will add 3 ml of our given solution, which either contains carbohydrate or it doesn't contains the carbohydrate, and we add 3 drops of our given indicator, which is alcoholic naphthol. Then we take another test tube and add 3 ml of concentrated H2SO4 in it. So now all we have to do is to slowly add our concentrated H2SO4 in the original solution. Then we will wait for a moment and roll the test tube in our hands like this, so that the solution is mixed thoroughly. Then we will, if carbohydrates are present, we will see a violet colored ring at the junction of these two solutions. This is indication of the presence of carbohydrates in the given solution. So conclusion will be violet colored ring. So if carbohydrates are not present in the solution, then we will not see any of the this colored ring. Additionally, we can also see green color due to some impurities which can be present in the concentrated H2SO4. So now let's talk about clinical significance of this test. So this test is worldwide used to detect any malabsorption in the small intestine. As we know that all the nutrients which we take in through our diet are absorbed in our small intestine. So this test is used to detect the malfunctioning of small intestine to absorb carbohydrates, because this is obviously this is a test to detect carbohydrates. Now we will talk how we do this test on a patient. So first of all, we give patient a dose of a carbohydrate known as xylose. So xylose is a monosaccharide, and it has a special feature that it is absorbed directly by the small intestine before any kind of digestion. So this monosaccharide does not require any enzyme for its digestion, so it is absorbed directly by the small intestine, and furthermore it is not used by our body in any kind of metabolic reactions, and also it is not reabsorbed in kidney, so it is excreted in the urine as it is. So it is a perfect monosaccharide for us to test any malfunctioning in our small intestine. So all we have to do is to, first of all, we give patient a dose of this monosaccharide. Then we will examine the urine of our patient within next 5 hours. So we will perform this Molichs test on the urine of this patient in the next 5 hours. So if his urine contains a significant amount of this carbohydrate, then this will be a sign that intestine is properly absorbing this carbohydrate. So there is not any clinical condition present over here. But if the small intestine of that patient is not absorbing the carbohydrate, then we will not detect this carbohydrate in a significant amount in the urine. So what is that significant amount? So if the urine contains 23 to 50% of the original dose that we gave to the patient, then it is an indication that intestine is properly absorbing the carbohydrates. But if the intestine does not contain this carbohydrate at all, or it contains less than 20% of this carbohydrate, then this is a clear indication that there is a malabsorption of carbohydrates in the intestine. and the patient requires treatment. So that's it for today. Thanks for watching. Subscribe to the channel to get more such videos. Goodbye.